substance use disorder and co-occurring mental health conditions. Substance use disorder, SUD, is often complicated by the presence of co-occurring mental health conditions, such as depression, anxiety, bipolar disorder, or post-traumatic stress disorder, PTSD. These conditions, known as dual diagnosis, require integrated treatment to address both the addiction and the underlying mental health disorder simultaneously. In this article, we will explore the connection between substance use disorder and co-occurring mental health conditions, how they interact, and the importance of seeking comprehensive treatment for both issues. 1. Understanding the link between SUD and mental health disorders. Many individuals with substance use disorders also struggle with mental health conditions. The relationship between the two can be complex. Sometimes mental health issues precede substance abuse, and in other cases, substance abuse triggers or exacerbates mental health symptoms. Self-medication. Individuals with mental health conditions may use substances as a way to self-medicate or cope with symptoms. For example, someone with anxiety may drink alcohol to calm their nerves, or someone with depression may use drugs to numb their emotional pain. Worsening of symptoms. Substance abuse can also worsen underlying mental health conditions. For instance, alcohol can amplify feelings of depression, and drug use can exacerbate symptoms of anxiety or PTSD, creating a vicious cycle of self-medication and worsening mental health. 2. Common co-occurring disorders. Several mental health conditions are commonly seen in individuals with substance use disorder. Some of the most common co-occurring disorders include anxiety disorders. Anxiety is one of the most common co-occurring conditions with substance use disorder. Individuals may use substances to alleviate anxiety, but in the long term, the substances can exacerbate anxiety symptoms and increase dependence. Depression. Depression is frequently seen in individuals struggling with addiction. Substance abuse can lead to feelings of hopelessness and worthlessness, and in some cases, substances like alcohol or drugs may contribute to the development of depressive symptoms. Post-traumatic stress disorder, PTSD. PTSD and SUD often co-occur in individuals who have experienced trauma. Many people use substances to cope with the emotional pain associated with PTSD, but this can worsen the effects of trauma and make recovery more difficult. Bipolar disorder. People with bipolar disorder may turn to substances during manic episodes or to alleviate depressive states. However, using substances can interfere with managing bipolar disorder and worsen the course of the illness. 3. Integrated treatment for dual diagnosis. The treatment of substance use disorder and co-occurring mental health conditions requires an integrated approach. Treating only one of the conditions can lead to relapse or incomplete recovery. For example, addressing addiction without addressing the underlying mental health condition may result in the individual continuing to use substances to self-medicate their psychological symptoms. Therapy. Cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and motivational interviewing, ME, are commonly used to treat both SUD and mental health conditions. These therapies help individuals address the underlying emotional issues contributing to their addiction while developing healthier coping strategies. Medication. Medication-assisted treatment, MAT, may be used to help individuals manage withdrawal symptoms and cravings. In addition, antidepressants, anti-anxiety medications, or mood stabilizers may be prescribed to treat underlying mental health conditions. Support groups. Support groups such as Smart Recovery, 12-step programs, or dual diagnosis specific groups offer individuals a community of support where they can address both their addiction and mental health struggles simultaneously. 4. The importance of comprehensive care. Treating substance use disorder and mental health conditions together provides the best chance for long-term recovery. Integrated treatment programs that combine medical, psychological, and social support are crucial for individuals with dual diagnosis. Coordinated care. Treatment providers, including therapists, doctors, and support groups, should work together to create a comprehensive care plan that addresses both the addiction and the mental health condition. This ensures that all aspects of the individual's recovery are taken into account. Holistic support. Holistic approaches that incorporate mindfulness, yoga, and exercise may also be beneficial in addressing both physical and mental well-being, providing a well-rounded approach to recovery. Key insight: substance use disorder often occurs alongside mental health conditions. Comprehensive, integrated treatment that addresses both issues is crucial for long-term recovery and overall well-being.